Lagan Valley Hospital's Urgent Care Centre operates a phone-first service only. You will be assessed over the phone and given an appointment if you can be treated at the centre. If specialist care such as paediatric or surgical is required, you may be directed to an alternative service better equipped to meet your needs. When you arrive for your scheduled appointment at the Urgent Care Centre, you must book in at reception. A nurse will call you for a brief initial assessment of your condition. This involves a short discussion about your reason for attending the Urgent Care Centre, and you may need clinical observations to be recorded or a brief examination by a nurse. The nurse will then decide if you need investigations such as blood tests or heart tracing, depending on how you are and the information you've given. If you do require investigations, you will be asked to take a seat back in the waiting room and you will be called.
Elizabeth Brown.
Please listen carefully for your name. After your investigations, you will then go to the waiting room to be called and further assessed. You may have to wait again in the waiting room after the initial assessment by the doctor for blood results or scans. Blood samples are tested in the Royal Victoria Hospital's laboratories, and it can take 4 to 6 hours for results. When all your results are reviewed, the doctor will inform you of the decision to discharge you or admit you to hospital for further treatment or investigations. If admission to hospital is required, your bed will now be booked. At this point, you are now under the care of the medical team of doctors who will either come to assess you in the Urgent Care Centre and put a plan in place, or you will be moved as soon as a bed becomes available to a ward that is able to provide you with the care you need. You may be transferred to another hospital in order to receive the appropriate care and treatment. We are aware the department is frequently busy. We really appreciate your understanding while we prioritise the patients most in need of our help. Thank you for your attention.